Doctrinally, at the FRSDs, we provide far forward surgical and resuscitative capabilities, kind of that damage control surgery, damage control resuscitation. For this exercise in particular, we are augmenting a role 2 and providing surgical capabilities. The soonest that we can do an intervention to that warrior who was hurt, the better outcome that warrior will have to preserve life, limb, and eyesight.
We are trying to set the precedent for what to expect for other units, determining these doctrinal expectations and hit times. What we've calculated is that we can be ready to take a surgical patient in about an hour. With setting up our ISO shelters, the first one being designated for ATLS and operating room, and then having our entire setup with the ICU ready to go and everything is probably closer to 90 minutes.
So we've been trying to mitigate some of those things that we normally don't have to worry about. The efficacy of medications after they have frozen and thawed, or how long our batteries will last, or how can we transport some of our medical equipment, the ventilators, so they're not freezing.
I think the biggest limitation would be getting heat. We can't perform surgery in a cold environment. We've taken temperature sensitive supplies, such as our first set of OR instruments that we might use, and any meds or our sterilizing liquids that can't be frozen, and we've put those in a warm environment. And then everything else we've allowed to freeze, knowing that we'll need them to thaw when they need to be used. Otherwise, we would be mission incapable once we arrive.
When we're out there in the fight, we're ready. The challenge with that will be how to be that high-speed healthcare professional, whether that means pulling somebody off a Skedco through a pile of fresh snow, T-CCC in the Arctic with our snowshoes on. The FRSD will know how to operate and be the best medical support system in this environment.